All right, this is elbow supination, and I'm going to have my patient hold their arm at a 90-degree angle. For elbow supination, the stationary arm is placed perpendicular to the floor and parallel to the humerus. So we're going to do it right here. The mobile arm is distal to the radial ulnar joint, and then the axis of rotation is the medial and proximal ulnar styloid process. So right about there. And now I'm going to have him supinate, which is palm up. So go ahead and do that. And he is 90 degrees, and the normal range of motion is 90 degrees. So for ankle inversion, I will have my patient sit on the table with his feet hanging off. The stationary arm is placed on the midline of the lower leg, with the mobile arm lined up with the third metatarsal. The axis of rotation is midway between the medial and lateral malleoli. I will now have my patient do inversion. So go ahead. So with that, his range of motion is 24, and the normal range of motion is 30. So for the subscap muscle test, I will have my patient lay prone with his shoulder and elbow at a 90-degree angle, and I will have him internally rotate, and I will apply pressure as he resists. Perfect. So for that, his score is a 5. So the action is it internally rotates the arm. The origin is the subscapular fossa, and it inserts at the greater tubercle and humeral neck. So for the biceps femoris test, I'll have my patient lie prone on the table with his knee flexed at a 90-degree angle. So for the test, I will pull downwards as he resists, and go. Good. So his score is a 5. The action is a hip extension, knee flexion, and knee external rotation. The origin is the ischial tuberosity, where it inserts at the head of the fibula and the lateral condyle of the tibia. So this is the thoracolumbar extension with the tape measure. For this test, I will have my patient stand with his feet shoulder width apart. I will place the tape measure on the C7 to S1. Once I have the tape measure in place, so we're gonna start right here and then go down, get centimeters. So right now he's at 37, and go ahead and put your chest to the sky for me, and I will redo it. And he goes to 32, so he has 5 centimeters. So the normal range of motion is 4. The muscles that help this action take place are the iliocostalis and the longus mus. This is the thoracic trunk extension. For this test, I will have my patient laying face down. To do this test, he will put his hands behind his head, and I will put pressure on his ankles as he lifts up. Okay. And for that, because he's able to go up and hold it for a few seconds, his score is a 5. The muscles that help with this movement are the iliocostalis laborum, iliocostalis thoracis, spinalis thoracis, longus mus thoracis,